Good morning. My name is David Berry. I'm the hospital's Chief Operating Officer, and it's my pleasure to welcome you and to thank you for being here today in this very special presentation from our Project Search interns. There are at least 3 guests and one of our own that will join us here at the podium for the next few minutes, but it's my privilege to introduce you to Project Search Director Jenny Adams. She'll be joining me here in a few minutes. Our Commissioner of Arkansas Rehab Services, Alan McLean, also with us today. Our Project Search intern representative from the class, Marcus Blair, right to my left. And from our hospital, Jenny Janesco, who is the Pediatric Intensive Care Unit Nursing Director, and Jenny will be here in a few minutes to visit with you as well. Thanks for joining us, and I'm so glad to have to be flanked on either side by our Project Search interns. We're just glad that you're here and hope that you're getting as much from your experiences with us as we are in getting to know you and work with you. Our special thanks to the Arkansas Rehabilitation Services, a division of the Arkansas Department of Career Education, for funding Project Search. I can't tell you how excited we are to have you all here. Thank you so much for that effort. Here at Arkansas Children's Hospital, we have an important mission. We're committed to championing children by making them better today and healthier tomorrow. That's our mission, something each of us here at ACH lives and breathes every day, all united, supporting the children in our own individual way, contributing our talents and abilities from the bedside through the ranks of administration and all points in between. Nothing excites us more when we get to do that and when we get to partner with those community leaders and others who join with us in sharing our mission. And today you're about to see that indeed that is the case with Project Search. Earlier this year, we were honored to have the opportunity to welcome 13 interns from Project Search, a program that provides job training through internship opportunities to individuals with developmental disabilities. Access Schools is our educational partner and provides the staff to run the program. Of those 13 interns, each of them work 20 hours a week over 10 weeks. That's about 200 hours per intern, or about 2,600 hours on the job and on-the-job training, opening what we believe will be many, many doors of opportunity and a brighter future for them all. During their training, Arkansas Children's Hospital has the privilege to mentor, to teach, to build new friendships, and above all, to see the Project Search interns share in our mission, making children better today and healthier tomorrow. And for that, we thank each of you for your work and your service to us. Please let's join them in applause. And now I'd like to welcome Jenny Adams to the podium. She's implemented the program launch here in Central Arkansas, and she's led the team in the annual admissions process and has really been instrumental in serving as counsel for the program's participants and the leaders around the hospital that she works with. Jenny?
I just want to share a little bit about ACH Project Search. Well, first, it's a very unique program. It's, as David said, an internship program for young adults with developmental disabilities. These young adults have an amazing opportunity. They get to spend 9 months working here in departments all around the hospital. We have 16 different departments that we work with. During that time, not only do they get on-the-job training, but they also get employability skills, job skills, and social skills that they're going to need to help them be successful on the job. The whole goal of Project Search is employment. The time that they spend here is used to help them find a job when the program's over. When they graduate, the Project Search staff not only help them find employment, but they also provide follow-along services for them in the community in their new jobs to help them be successful. For many of the young adults in this program, being an intern at ACH comes full circle for them. Growing up in the Little Rock community, many of them have received health care here at Arkansas Children's Hospital. And now Arkansas Children's Hospital is helping them in the next step of their life. They're no longer children receiving care here, they're adults finding employment. ACH is able to help them make that next step in life. This program is not possible without its 3 partners, Access, Arkansas Rehabilitation Services, and Arkansas Children's Hospital. I want to thank Access, specifically Tammy Simmons and Susie Rogers, for part of their vision in bringing the program to Central Arkansas and helping. We have an expansion project. Project Search in Central Arkansas started at UAMS 2 years ago, and now it's here at Children's Hospital, and we have more expansion in the future, which is very exciting. Both of those ladies have worked very hard on the expansion project that's coming to Arkansas. I'd like to thank Arkansas Rehabilitation Services. They're our funding partner. Without their financial support and leadership, none of this would be possible. I'd like to specifically thank Judy Smith and Joseph Baxter. They were instrumental in the development of the expansion project for Project Search. And of course, we have to thank Children's Hospital for being a fabulous business partner, for having 16 departments that are willing to work with all of our interns and provide them on-the-job training. I'd like to thank Robin Reynolds. She's the Director of Volunteer Services. There she is. She also serves as our business liaison here at ACH, and she has helped her department head up Project Search here at ACH. And thank you to Will Walker in Nutrition Services for helping to provide nutritional lunch services for our interns. Next up, I'd like to introduce Alan McLean. He's the Commissioner of Arkansas Rehabilitation Services. He also has a young adult who graduated from Project Search.
Thank you, Jenny. It's a pleasure to be here. Over the years, I've had an opportunity to be a part of several state agencies, and I've only been with ARS for 8 or 9 months now, but never have I been a part of an organization or a state agency that is as fulfilling and as exciting to be a part of with such a great mission as ARS has. So I'm very excited that this agency that I now get to be a part of is able to partner with so many other people with the vision of Tammy Simmons and Access Group and Children's Hospital to be a part of this. And it goes back to just even getting the legislative authority a couple of years ago, or actually in the last session, to do the expansion of Project Search. So there's some visionaries way before me that were a part of laying this important groundwork. So I'm also pleased to express thanks to Dr. Sharice Childers, who's the director of the Department of Career Education, under which ARS resides in state government. And our legislators, Governor Hutchinson, we had great support for moving this legislation along and for the Project Search expansion. So it's real important that these leaders were in favor of the legislation, which allowed us to spend the money to move Project Search expansion along and to result in this site. So, this is an important collaboration. So I want to thank the Children's Hospital leadership for being a part of that, and all the supervisors and all the staff that have really come together to catch the vision for Project Search. Your Children's Hospital site is the first of 8 expansion locations. So we're very, very excited about this, and there's no doubt that there will be many success stories of changed lives that come about from this first class of interns and the interns that are here to follow. So the lives of the interns will be changed, the lives of the staff will be changed, the lives of the job coaches and everybody that works together, and the lives of your patients will be impacted as well. And I don't doubt that this is already happening within the community here at Children's, just in the short time that this first group of interns have been here. So everybody's world is going to be made brighter because of Project Search here. Project Search is an evidence-based program. Project Search is a national organization. Nationally, the outcomes are around 73% in Arkansas. Locally, Project Search has achieved higher outcomes of over 91% in Project Search already. So there's great results and great tracks to run on here in Arkansas. So ARS is completely believes that the goals of Project Search are aligned with the mission of what we do at Arkansas Rehabilitation Services, and that is to help individuals, Arkansans specifically, with disabilities to enter the workforce and earn a competitive wage. So Project Search is a very important next step in the lives of many of our clients with intellectual and developmental disabilities to enter the workforce. And so Project Search is undeniably a great investment in our clients, their families, the communities, our state, and the nation. So I pledge my personal commitment and our continuing support of ARS to Project Search and the goals for continued expansion. There's no denying that Project Search works. Our graduates get the opportunity to reach their career goals. And I know this, as mentioned from my own personal experience. I have a 21-year-old son, Nathan, who has Down syndrome, and he happens to be a very proud Project Search graduate. And I told him I was coming here. I said, Nathan, you could give the speech better than me about how the impact of Project Search in his life, because he will tell you that he loves to work. He loves his job at Little Rock Catholic High School, and he gets up every day excited about his job. And he was involved in Project Search before I ever thought about coming to work at ARS. And so Project Search was already a big part of my life before I ever came into this role. So on behalf of Arkansas Rehabilitation Services and the Department of Career Education, I want to thank everyone involved in the success of Project Search, the interns, their families, the Arkansas Children's Hospital leadership, staff and volunteers, the Business Advisory Council, steering committee members, and all the other stakeholders who make this happen. So particular thanks goes to Tammy Simmons and to Jenny Adams, without whose energy and vision this would not have been a success. So thank you again. And now I want to introduce Project Search intern, Marcus Blair.
My name is Marcus Blair, and I'm speaking on behalf of the inaugural class of ACH Project Search. Let's recognize our current intern standing next to me. Many of us have been patients at ACH as a group. We wanted to give thanks to ACH for welcoming in our role as interns at Project Search. We spent several weeks working with artists in residence, Hamid and Elizabeth, creating our heart piece. We would like to give them thanks to them for supplying us with support and materials. We spend lots of time researching the theme of our art piece. We worked very hard, and we know that you will love as much as we love making it. We hope that our art will show patients that even though we are all different from each other, and there is beauty within each one of us. Now, I would now like to ask interns Jared and Katie to come forward for the unveiling. Jenny Janesco, Nursing Director of Pediatric Intensive Care Unit, would you step forward to accept our donation?
Thank you very much. I'm honored to accept this beautiful gift on behalf of the hospital. As Marcus stated earlier, several of the Project Search interns have been patients at our hospital. I can't wait to see this move around so that everyone can enjoy it throughout the campus. We're very excited that we had the opportunity to include these interns into our teams and watch as they really help change the lives and also inspire our current patients and families.
Wow, thanks so much for this incredible gift of your art and your creativity and your expression to us. Our patients and families and our staff will enjoy it for many years to come. Thank you for it. And thank you for your service. As you learn, you also provide us opportunities to get to know you and a chance to learn from you as well, and we're grateful. Wanted to acknowledge Robin and her leadership in hammering out a lot of the details to make Project Search possible here at Arkansas Children's. And thank each of those 16 departments that have made a huge difference in working with the interns to make them part of their department. I was speaking with one just the other day who was so excited to have an intern and to see what he was bringing to their department and what they were learning from him and what he was able to do to help in delivering patient care, and we're grateful for that. Thanks to each of you all for being here today and for your words. Thanks for what you do on behalf of the citizens of Arkansas, these interns, and for the patients and families at Arkansas Children's Hospital. Better today, healthier tomorrow are our watchwords, and we know that you're as invested in that as we are. And with that, we'll close. Thanks again for being here. We'll be happy to entertain any questions. Probably my guest will be able to answer much better questions, or many questions that I can, but we're glad that you're here, and we'll be happy to entertain any questions. Bye.